Hi, I'm Samantha Mango, and welcome to Sullivan 180 Presents Take 5. Our guest today is Rolland Boomer Bojo from Garnet Health Medical Center, Catskills, the Grover Hermann Division. Welcome, Boomer. Thanks for joining us today.
Thank you for having me.
Do you mind introducing yourself, your job title, and a brief description about your organization?
Sure, I would love to. As you said, my name is Rolland Bojo, better known as Boomer, and I am the Vice President of Patient Care, Chief Nursing Officer for Garnet Health Medical Center, Catskills, and the administrator of our Critical Access Hospital in Callicoon.
Do you
Thank you.
mind talking a little bit about how both Garnet Harris, Grover Hermann Hospital, and your staff have been dealing with the challenges of COVID-19 recently?
Sure. A lot of people may not even be familiar with the term of Garnet Health Medical Center,
Right.
as we have renamed ourselves, and actually that became official on June 18th, which was my 50th birthday.
Oh,
So it
happy
was kind of
birthday.
a exciting day. Thank you. Um, we decided that working, we had Orange Regional and Catskill Regional medical centers, of which Catskill we had the Harris Division and the Calhoun Division. So we felt like we needed one kind of unifying name to really bring us together, because we are a system, and a system that works very well together. So during COVID, I think we're ahead of the curve. We have always had a pandemic plan that we have worked on and kept up to date and done some drills with. Leadership for the system really had the forethought when we started seeing things happening in other parts of the world to say, you know what, I think we need to take a look at this, and we need to come up with what we would do if this actually comes to the U.S. and we are affected. And that served us very, very well. When things started getting really crazy, we had plans in place as a system. So I think overall we did a really good job responding to COVID. We saw a large number of patients. I say Sullivan County was kind of that transition county between the really tough areas from Orange down through New York City, and then the rest of New York State that really at that time didn't get hit quite so bad. So we were really that transition county, and I think we were able to step up and really be a leader in the community, working with public health and fire and EMS and emergency management from the county and Sullivan County in general, just to make sure that we were meeting the needs of the community. And I say this all the time, we're very fortunate to be in this county. This county is very supportive of this hospital, and the connections that we have formed throughout the county are so beneficial. And I think people in general don't really realize at times like how important relationships are and how important teamwork are. And this again was another prime example of that.
What do you see in general are the biggest needs of our Sullivan County residents, and how can they get help from the hospital system?
I think the biggest thing right now is just, I think people are still a little scared about coming to a healthcare institution in general. I think that people still are weary of, that there may be COVID or they may get COVID coming to a healthcare institution. And it's actually probably the best place you want to be, because at least for our system, we have taken extensive infection control practices. There's people that go around all day long and all they do is clean high touch areas, the elevator buttons, the door handles, the railings. And it's really been done very, very well, because we want to protect our residents, our patients, and our staff. So by people not coming to healthcare as much, I think they're running into trouble. So they're, maybe not following up with a primary care doctor quite so frequently, or they're waiting, they're having that chest pain and they're waiting and saying, well, I don't really want to go to the ER because I don't want to get COVID. And then 12 hours later, they're having the big heart attack. And so the number one thing I think is just really encouraging people to know that healthcare is safe. We are here to help you. So please, if you need healthcare, please come to receive it.
Is there anything else that you'd like to add?
Just again, I know I've said a lot about this, but the community support has just been unbelievable. And I honestly don't know if we would have made it through, but it would have been a lot harder on us without the support. We saw a lot of love from the community, and a lot of people. We had people just show up outside and just hold up banners saying thank you. You're our heroes. And people don't normally think of nurses and doctors and housekeepers and those type of people being heroes, but they were, and they are.
Can you let us know the best way to reach you and or your organization for more information?
Yeah, so probably the easiest way would be our website, which is garnethealth.org. Or if somebody just wanted to reach out to me directly or had questions, they can contact our main number, which is 845-794-3300, and just ask for me. They'll find me.
Well, thanks so much for your time, and thanks for being here, Boomer, and big thanks to Garnet Health for all of their efforts the past couple months and always for Sullivan County residents.
Thank you, and thank you for having me, and thank you for all you guys are doing.